Welcome to another exciting episode of Med Nation Podcast, where I'm Dr. David Farnen, and with me is my co-host,
Dr. Lanier.
Today, we have a special guest joining us as we delve into the cosmetic plastic surgery with Dr. Ashley Guthrie. Dr. Guthrie, please welcome yourself and introduce yourself as well, but welcome to Med Nation, by the way.
Hello. Thank you so much. I'm excited to be here today. So, as Dr. Farnen said, I'm Ashley Guthrie, and I am a facial plastic surgeon here in Brentwood/Nashville, Tennessee.
We are delighted to have you, Dr. Guthrie. This is exciting.
Yes, absolutely.
It's so funny. I'm downstairs. You're upstairs. I'm in Brentwood today.
We're so close.
We're so close. Tell our listeners about yourself a little bit and how you started in this field.
Absolutely. So I did my training in ENT, head and neck surgery back in New York. I'm from New Jersey, so I wanted to be there for my residency training close to home. So I did my 5-year residency there at Mount Sinai. And then during my residency, I decided I really enjoyed the facial plastic surgery aspect of ENT. I don't think a lot of people realize that that's actually a big part of ear, nose, and throat training. And that's one of the main specialties that people can choose to go into after that. So I chose to do an additional year of fellowship training, primarily in cosmetic facial plastic surgery, but some reconstructive as well, in Birmingham, Alabama with Dr. Russo. So I did that additional year of training in his private practice, which was great experience. And then I moved up from Birmingham to Nashville. I had a lot of family that had recently moved to the area, so I decided it would be a good place to open up shop, and I opened my own practice right out of fellowship.
Yeah, I kind of know, some of your story as well, but it seems like you really hit the ground running, and that's really inspiring. Starting your own business after fellowship. What sets your approach to cosmetic plastic surgery apart from others?
I'm really focused on people looking natural, looking like themselves, just kind of an improved version of themselves. I know there's lots of people out there who are so afraid to have any kind of plastic surgery done because they see the people that look so strange afterwards, and it causes a lot of trepidation for people into getting anything done or even exploring things. So I just really focus on making people look natural, just healthy, more youthful versions of themselves. That's really always my goal. I'm very conservative. I don't like to do anything to someone that cannot exist in nature, if that makes sense. I don't want anyone to stand out in a bad way. I just want people to look good and have people say, hey, you look great, but not really be able to tell what happened.
I love that. And what I love, was you saying improved version of themselves.
Exactly.
I want to look improved version of myself. I might come up.
Absolutely. You're welcome anytime.
Well, let me just say, everybody, too, I am going to divulge this. This isn't, yes, it's not HIPAA, but there's only one person I allow to touch this glorious phase. And let me just tell everybody in Middle Tennessee, the only person that can touch his face is Dr. Ashley Guthrie. So.
Well, I'm very honored and I appreciate that. And if I ever need anyone to touch my feet, I know who I'll be going to.
Thank you. See, guys, everyone better be listening, because that was an incredible compliment. So
Dr. Guthrie, can you share some insights into the most common procedures and trends you have observed in the past few years?
Sure. I think in general, plastic surgery, it definitely kind of saw a boom during COVID. It was like the Zoom boom of plastic surgery. I think that's kind of settled down a little bit, kind of back to normal. But I definitely think it did make people more aware of their appearance and especially their faces, doing so many Zoom calls for work. So definitely an uptrend in facial plastic surgery in general. But some of the more common things that I perform are aging face related surgeries. So I do a lot of blepharoplasties or eyelid surgeries, both upper and lower, facelifts, rhinoplasties are very common. Basically, anything you can think of on the head or neck, I do it. But I would say the most common things are related to aging faces.
That's exciting. Do you have anybody bring you a picture of the Kardashians or any other celebrities and ask you to make them look like that?
I feel very fortunate that the vast majority of my patients are like very, I'll say, normal and have appropriate expectations and don't ask me for anything, out of the realm of what would be appropriate. So, I do have patients who show me younger pictures of themselves, which I always appreciate, just to give me a sense of kind of where they were at. That helps me also predict where we can get with our surgeries. Some people will show me ideas they have about certain noses they might like or lips or things like that. And those are always helpful as long, again, as it's within the realm of possibility for that person. There's limitations, of course, with everything. And so, it's important to kind of set expectations, but I always welcome people showing me examples of things that they like.
Yes, guys. And I just want to add here again, I'm the peanut gallery. I can attest. I showed her pictures of Ryan Gosling. Guys, let's be reasonable. I cannot look like Ryan Gosling. And no matter how much filler, just not going to happen. So.
No, exactly. But I mean, it's all about expectations in plastic surgery, especially with all of medicine, but particularly with cosmetic surgery, because if you set the expectations ahead of time, you're much more likely to have a happy patient and for you to feel good about what you did. You just want to make sure that you're not offering something that's just not achievable.
Yeah, I agree. Expectations all around. I mean, that applies to, and like you said, that applies to all specialties, including foot surgery. I think Dr. Lanier and I, we talk a lot about expectation because, when these folks come in for elective bunion surgery or just hammer toe surgery or corrective surgery for some sort of, aesthetic purpose, you do, to say, hey, I want the toe as straight as possible. It's just like any profession, like a dental veneer, I assume, or a rhinoplasty for you, or just in general. I mean, yeah. So we get that quite often.
Yeah, absolutely. It's important because, you want to make people feel excited and happy about choosing to undergo a surgery, but it's easy to let that get away from you and wind up with a disappointed person afterwards if you didn't point out things that might be limiting factors ahead of time.
Correct. Like I will never be Ryan Gosling. My Ryan Gosling.
You have your own look, Dr. Farnen.
Thank you.
Yes.
I'll take that as a compliment. So, Dr. Guthrie, what advice do you have for individuals considering cosmetic procedures, especially those who might be apprehensive or unsure?
I definitely think it's important to find a surgeon that you're comfortable with. Do your research. Look at who's out there, look at their websites, look at their social media before and afters. And, even that alone before you go to see the physician gives you kind of a sense of what they're like and what their style is. You can look at a surgeon's before and afters and get a pretty good sense if that's, someone you're kind of going to be in line with. You can look at one rhinoplasty surgeon and every single one of their nose is going to be relatively similar. And if that look is not something you like, then I wouldn't go to that person. You have to, and it's not right or wrong. It's just kind of getting a feel for what aligns with what you're looking for. And then I always encourage people to get multiple consultations. I know, of course, there's always fees incurred for consultations and things like that, but I think it's worth it, if you're going to undertake, especially a bigger surgery, so that you can get a feel for the physician, for the practice. Are you comfortable there? Do you feel comfortable, asking questions and being open with them? You definitely, I think overall are going to be happier and get a better result with someone that you can relate to.
And someone that's realistic. And exactly. You are very realistic and we appreciate that for sure.
Well, thank you.
So as we continue to talk about beauty and beauty standards, in your experience, how do you balance helping patients achieve their, aesthetic goals while challenging societal beauty norms?
Well, I mean, as I said, I think I've been really fortunate in my patient population here of just people who just have really good expectations and feelings related to these things. So, when people ask me for things that are a little bit trendier or things that may not be entirely necessary for people, I'm pretty honest. I'll tell them like, hey, I don't think you need this, or I don't think this is really appropriate for you. I'm very honest with people about those kind of things. Something I have run into, it seems to have quieted down a little bit, thankfully, but kind of the younger people with filters and TikTok and things like that. There must have been like a popular filter at one point a few months ago where it showed your asymmetries in your face.
No.
And I had a few people that came in and they were like, I don't think there's anything you can do for me. Like I have so many issues. And I'm looking at them. I'm like, what are you talking about? Like they look perfectly normal. And they're like, look at this picture. I'm so asymmetric. And, it's really sad. And, you kind of have to talk those people down and be like, look, you're perfectly normal. Everybody is asymmetric. Like,
Yeah.
don't do these filters anymore. Um, so I think in terms of like societal beauty norms, the filters and some of the social media have given people like a distorted view of what
Themselves, yeah.
they sort of view themselves and what looks natural and nice. And, it also kind of has made people in a way all want like this one cookie cutter look. It's kind of like the Kardashian look
Yeah.
with the microbladed eyebrows and the big lips and the whole look. So I think it's important to kind of encourage people to feel good about themselves and good about their own looks. Like everybody has their own unique look, and I don't want to make everyone look exactly the same.
Well, a perfect segue, in a world where social media and filtered images have become prevalent, how do you address unrealistic expectations and some patients might bring to the table?
I mean, I always try to explain to people again with like, especially the asymmetry thing. That's a big thing. And everybody has asymmetry in their face. And so that's something I, make an effort to point out to people ahead of time before I do anything so that they're aware of it. They know that that is not necessarily going to change. I talk to people about the fact that things that they see online and the filters are not realistic. Everybody has, imperfections in their skin. There's nothing you can do to get rid of every little mark or pore or, indentation on their skin. These are things that are normal human body parts. And one of the things actually that is a common issue with especially younger patients is like nasolabial folds, the lines on the sides of the mouth, which are normal. That's a human thing to have. And so I've got quite a bit of young people who are like, I hate this line here. Like, can you fill this in? And I have to try to explain that that's not human to not have that line. That line is part of your face. It's from smiling. And it just does not look normal or natural to completely obliterate that.
Do you have a favorite procedure that you do?
I really like doing eyelid surgery, blepharoplasties, because they're relatively easy for the patient to go through. It's a pretty quick downtime. There's almost no pain, but it makes a really dramatic result very quickly. By 2 weeks later, people look significantly better than they did before, and there's a very high satisfaction rate with blepharoplasties. So I enjoy doing them.
Awesome. So, well, Dr. Guthrie, as we wrap up, could you share a memorable patient success story that highlights the impact of your work?
Yeah, absolutely. I actually just had one yesterday who came for a follow-up that made me feel really great. So this was a really, really sweet patient. She had an upcoming wedding of one of her children. She was kind of, struggling with her weight and feeling badly about herself, especially kind of around the neck area. She wanted to do something, quick that could give her a nice improvement without having to go through surgery. So I did something called face tight on her, which is like a non-surgical way to tighten the lower face and the neck. So I did that with some liposuction as well. And she just got an awesome result. And she came in yesterday for her follow-up after her son's wedding. And she just gave me a little speech about how much better she felt about herself and how she was really able to enjoy the day of the wedding and not feel self-conscious about photos being taken of her, and just like how much more motivated she felt about, her life in general. And that just made me feel really great. And that's why I do it.
Yeah, that's it. That's awesome.
Yeah,
That's awesome.
absolutely.
Dr. Guthrie, thank you for joining us today on MedNation and sharing your insights into facial plastic surgery. I really love your realistic approach to beauty. If someone wants to consult with you, how would they reach you?
Absolutely. Thank you so much for having me. I always love speaking with you guys. So my practice is called Guthrie Facial Plastic Surgery. It's easy to remember because it's my last name. We are in Brentwood, Tennessee. My website is www.drashleyguthrie.com. I'm on Instagram as well at Dr. Ashley Guthrie. And feel free to give us a call and schedule a consultation. We'd be happy to see you.
Awesome. Thank you, Ashley. Have a
Thank
great week.
you. You too. Enjoy the long weekend.
Thank you. Bye-bye. Thank you for listening, and do not forget to subscribe to our podcast.